Researchers commissioned by the Academia Europaea gathered in September 2019 at the impressive headquarters of the Hungarian Academy of Sciences in Budapest to respond to problems in the field of translational medicine, or TM. TM seeks to bring findings from basic and clinical research, indeed a wide range of research findings, to patient care as quickly as possible. This figure illustrates the main areas of TM and the way the TM cycle is implemented. Questions raised in healthcare can only be answered in multidisciplinary working groups and published for colleagues, laypeople, decision-makers, and our partners in industry, so that these answers are turned into practice that facilitates patient care. Since the 2000s, the TM approach has developed a great deal, but various problems have also emerged which slow the spread of the process. For example, the problem of defining TM, of financing the various programs, and of the lack of TM centers, as well as the communication problems between the various levels. It is in understanding this that the Academia Europaea launched the project for which the workshop was held in Budapest in autumn 2019.
There are plenty of really excellent scientists and knowledgeable people came here to summarize what we need in translational medicine, and in that case Hungary also has a role, since one of the biggest center for translational medicine is in Hungary at the University of Pécs, and we are really very proud that the Academy of Europaea gave us the leadership in these projects to put everything together.
The primary guideline of the workshop was that an effort should be made to find answers to problem questions that may arise by bringing various ideas and data together.
First, I think it would be nice if at the end of the workshop we could have developed some consensus-based definitions. Secondly, to improve the field and to develop the field, we need to identify important challenges, and of course we should compose recommendations not only for scientists but also everyone who is inside translational medicine, including patients, politicians, insurance company, industry, publishers.
A journalist, a biostatistician, a member of the academy, an IT specialist, and a clinical physician all sat around the table and spoke about the central challenges in their talks. One of the key areas which all the speakers covered was the various levels of the TM cycle and the lack or slow pace of communication between the various players.
The communication problems exist at many different levels. There are communication problems between basic scientists who make discoveries and the clinicians who work in the hospitals, and that is one gap that needs to be bridged. But then there's another gap between the clinicians and the patients, and the gap between the clinicians and the politicians, the hospital administrators, and so on. So there are many different communication gaps, and we have to work in different ways in all these different situations.
The opening talks were primarily problem-oriented, with a focus on how TM is tied to healthcare, research, academia, and the different scientific communication platforms.
I think, translational medicine is a very big field, and it's a growing field. It has a lot of potential to impact the care and the quality of life for many people. And this was an opportunity to meet with fellows who have different aspects and that participate in the translational medicine enterprise from a different angle, and to exchange experiences and to try to identify potential challenges and propose solutions.
Funding is always a problem, and different countries have tried to solve that in different ways, but at the end we have to influence our politicians that must recognize that this is an important area where they need to give dedicated infrastructure funding, and if they don't give it, it won't survive.
The academies have the advantage that they have a certain authority in terms of scientific knowledge, because the members of academies are people who have been recognized by their peers as people who have made real contributions to science. So they have a kind of status in that respect, and we have to take on the obligation of using that status in spending efforts on communicating in language that is effective, clear, concise, so that recommendations can be understood at many different levels, and that's our job.
The University of Pécs Working Group is one of the leaders of the Academia Europaea project. This is in part an acknowledgement of the internationally renowned organizational structure and findings of the Center for Translational Medicine, which was established in Pécs, Hungary in 2016, the first such center in Central Eastern Europe. Thus, in the second half of the workshop, members of the center reported on the main points that have aided in improving the various areas of TM, and therefore in increasing their effectiveness. The 6 areas are as follows.
Translational medicine should be the healthcare setting where we see the patients, where the ideas start, and where we want to deliver better care for these patients.
There are many different methods and terminology which are currently used. Even today you could see at least 4 or 5 different figures which all summarized or attempted to summarize what translational medicine and translational sciences.
Translational knowledge includes all efforts to summarize and resynthesize current scientific information knowledge on a well-defined topic, again to advance research and practice. So the motto is the same: deliver easily available information, concise summaries for patients' benefit.
Translational communication is the professional dissemination of knowledge to the community, including but not restricted to patients, scientists, healthcare professionals, policymakers, insurance and pharmaceutical companies, and taxpayers. It should involve bilateral communication with a strong emphasis on receiving feedback from the target audience and reacting to it in a responsible manner.
What is needed besides the expertise in the specific field to do a research? These are several functions and roles which should be accomplished, starting with administration, project management, and there is IT needs or communication, statistics, then involving patients in research, for example, collecting data, checking data, fulfilling all the ethical and regulatory requirements.
Two major problems affect translational medicine as an academical field or problem. Its place in general medical education or biomedical education, also the evaluation of its typical publication forms. And the other problem is, like money, translational medicine is as yet not funded because it is not handled as a priority.
Workshop participants were very open. Every talk was followed by a lively exchange of ideas, where those with comments or questions were not only expressing their own views, but promoting a common way of thinking by raising new questions.
At the end of the project, I think we will be able to give suggestions for politicians, for academic persons, for universities, and each participant what we need to bring knowledge back to community and also for patients' benefits.
However, the workshop not only consisted of talks and discussions, it also featured unstructured events, whose main aim was to help visitors get to know Hungarian culture and cuisine. The wine tasting was a good opportunity for participants to enjoy a glass of wine while exploring different Hungarian regions, even if only virtually.
The Romans already cultivated vineyards and grew grapes, most of the regions, and in Saxard as well. But if you imagine those wines that the Romans drank, it's totally different from the one that you are having now in your glasses. First of all, they kept the wine in amphoras, and they didn't know anything about the techniques, how to treat the wine, and of course they didn't filter the wine. And if the wine got spoiled, then they used different kind of herbs like lavender or rosemary.
The other treat was an evening of Hungary's multifaceted folk dance at the Danube Palace in Budapest, the highlight of which was that it was opened by the host, Professor Hegyi, and his daughter Eszter. The two-day event raised a great many issues and resolved quite a few as well. Participants agreed that the conversation needed to be continued. After all, they share a common goal: the most effective patient care possible, a 21st century framework for which is assured by translational medicine.
During the workshop, we've discussed such a wide range of activities, and I think what's important here is that there are examples in Europe already of translational research centres which are very successful. And I think rather than reinventing new ones, one should try and look at what the activities are that are currently being delivered in translation research.
I'm optimistic in the sense that at least some improvements will be made. Obviously, we would like the improvements to be on as large a scale as possible, but as long as we make some improvements, then that already would be a justification of the project. Let's be realistic, we are not going to change the whole world by one report. But if we can move things a bit, then that's already, I think, not bad.